So we're going to talk about, I think, what is the most damning thing about chiropractors. And this is their dirty secret. And this is that neck manipulations and strokes have quite a high causality. We're going to go through basically these published reports, and there are a lot of published reports. In 1992, researchers at the Stanford Stroke Center asked 486 California members of the American Academy of Neurology how many patients they had seen during the previous 2 years had suffered a stroke within 24 hours of neck manipulation by a chiropractor. So, a total of 177 neurologists reported treating 56 such patients, of all of whom were between the ages of 21 and 60. One patient had died, and 48 were left with permanent neurological defects such as slurred speech, an inability to arrange words properly, and dizziness. Oh dear. But it doesn't stop there. In 1993, a review concluded that a potential complication and unknown benefits indicate that children should not undergo neck manipulation. Oh dear. Louis Spaltella, a president and former ACA, which is the American Chiropractic Association, board member, contends that chiropractic neck manipulation is quite safe. And in a 1994 interview reported by the Associated Press, he related to the American Heart Association by studying, "I yawned at it, it's old news." Again, this is a guy on a board who probably should be warning people about these cases. And he's quite dangerous. Again, 1996. Another one tabulated that more than 100 published case reports and an estimated that number of strokes and cord compressions and fractures and large blood clots were 1.64 per million neck manipulations. Even though that's a small number compared to when you're talking about other things, you've got to think how many neck manipulations and things like that do chiropractors potentially do a day in, particularly UK. Think how many there are in the UK. Think how many they do a day. That soon adds up. Yep, and then here, in 1996, the National Chiropractic Maternal Insurance Company, which is the largest American chiropractic manipulation insurer, published a report called Vertebral Stroke Manipulation Following Manipulation. Based on his findings of 183 cases of strokes reported between 1934 and 1994, and concluded that 150 manipulations administered by chiropractor, 25 were done by a medical practitioner, 31 have been done by another type of practitioner, and the practitioner type for the remaining 22 had not been specified in the report. He concluded that it was very rare and seldom able to predict who was actually more likely to succumb to it. So, if anything, again, we're not finished with a lot of these, because all these, again, 1999, another review was done. Again, 60% of strokes via neck injury, 60% were caused by chiropractors. Again, there's another one in 2001. Again, link that neck manipulation has caused strokes. Again, another one in 2001 by Canadians from results between 1993 and 1998 using hospital records. Again, there's a clear link, all caused by chiropractors. Surprise, surprise. Again, another one, 2001. British researchers report on a survey in which all Association of the British Neurologists asked reports for referred to them from complaints within 24 hours of a neck manipulation of a 12-month period. 35 reported cases included 7 strokes involving the neck artery, 2 strokes involving cardioid artery. Again, there's a very clear link. And again, another one done in 2002, another one done again in 2003, again in 2006, the Journal of Neurology, again finding a link, again another one in 2006. So it's not like this is a thing, again, and chiropractors do know about it, except again they're taught that, again, they downplay about it. Some chiropractors here, it says, advocate screening, detecting individuals prone to stroke during neck manipulation. These tests include holding the head in positions, rotating to see if the patient gets dizzy, are not reliable, partly because manipulation can rotate the necks further than it can be done with the tests. So again, they are completely incapable of performing an accurate test whether you, as a patient going to them, are susceptible to this. Again, there's basically a quote here from a former patient, and he's been, I've been doing vascular surgery rotation for the past month, which is part of my postgraduate medical education. During my chiropractic training, when the subject of manipulate-induced stroke was brought up, we were reassured that millions of chiropractic adjustments are made each year and that only a few incidents of stroke have been reported following neck manipulations. I recently found that 2 of the patients on my vascular service that had suffered a stroke had undergone neck manipulations by a chiropractor, one on the day of this day that the symptoms began, and the other had started 4 days afterwards. I have seen 2 in the past month. Therefore, I urge my medical colleagues to question the patients regarding recent visits to a chiropractor and neck manipulation when confronted with patients presented with neurological symptoms of stroke. And I urge chiropractic patients not to allow their necks to be manipulated anyway. The risk to benefit ratio is far too high to warrant such a procedure. So, the chiropractor's main thing of neck manipulation, highly dangerous. And again, I'll leave this link below because, again, this isn't just one report. This is starting from 1992 and it goes all the way on here to 2001. And I guarantee there are probably more since that. So, again, I'm interested to know how many people have gone to see chiropractors and how many people have been, subject to this test. Have you been to a chiropractor? Have you suffered a stroke after having a chiropractic adjustment? Maybe that was your cause of having your stroke. I'm interested to know what people's reaction to that would be.